So change in businesses and organizations can be scary, especially in hospitals and healthcare organizations, as patients, their health will depend on the outcomes. However, in this new era, we believe that also hospitals could benefit from the use of technology. This could improve overall patient satisfaction and also that of doctors and nurses. Overall, we believe that the use of technology can make lives of many in hospitals easier. This is why we want to start by introducing technology in the Department of Ear, Nose, and Throat. So our idea for an healthcare innovation is digitalizing the ENT department in the Netherlands. We will explain the importance of incorporating our innovation into the care delivery model by using the 6 main phases in the improvement process according to the NHS Institute. The very first phase is setting direction and priorities. We see this as a discontinuous innovation, as Aurelian Tushman would say. This will alter the basis for competition by rendering ways of working obsolete, not only for other ENT departments, but also for the rest of the hospital. This is a whole new way of working. Most hospital departments are very far behind when it comes to digitalizing the workspace and the work itself. The farthest Dutch hospitals have come is working with an EPD, an electronic patient dossier, by our way of working, we take it a step further. We expect our innovation to be successful. According to Brunner, using existing resources is very important. That's why we'll use the existing EPD software and turn it into an application for tablets. This way the nurses don't have to learn the whole new system, they will use the existing one, but rather more efficiently. Also, by introducing our innovation, we are reducing existing inefficiencies in hospital departments. Besides, we are creating a new wealth in societies by bringing a new product on the market. The second phase is understanding the issue. One of our own has experience as a nurse in the hospital. She found that the hospital wasn't using technology as efficiently. A lot of work, mostly administrating work, could be done differently, more efficiently. By changing this up, the nurses would have more time to improve the care delivery in other more personal ways. So the third phase is developing ideas. We will start with a pilot in a regional hospital where all nurse patients are given a tablet. Every patient can communicate with the nurse through an application installed on the tablet. When assistance of the nurse is necessary, the patient can ask for help by choosing one of the many pictograms on the tablet. This way of working is especially beneficial for patients who have had something done to their throat. Also, this application will help the nurses with their work. Firstly, the nurses can easily understand the needs of their patients. This will help with giving customized care to each patient. Secondly, the nurses have the opportunity to prioritize their work. Each of them will receive a push message on their smartphone when a request has been done. Whenever a nurse has the time to assist a patient, the nurse can accept the request. This way the other nurses know it's been taken care of. Lastly, when the nurse visits the patient, all new giving information can be put into the EPD immediately. This helps the nurses with their workload of administration. They don't have to digitalize anything after they have seen the patient. This way there is no chance of forgetting to transcribe important information to the patient's dossier. In short, use of technology will assist the nurse to enable to improve the delivered care. The fourth phase is testing and learning. Before starting with the intensive field testing and evaluation, which will take place during the 1-year pilot, we will undertake a quick simulation and test our application. This will be done by one simulation nurse and a simulation patient. After a successful test, we will take it into the real field. Shortly after comes phase 5. This is designing the delivery. The implementing process will be as following. According to Mugglestone, Maher, Manson, and Baxter, key elements of evidence and experience from other domains can be used to improve healthcare. For us, customer satisfaction, in this case the nurses and the patient, is very important. That's why we are aiming at making the application as user-friendly as possible by evaluation with the users. For the pilot, we will be using experience-based design. In this way, we will not only ask the users about their requirement, but also involve them into co-creating solutions. Also, this innovation is more of an incremental improvement. The nurse already uses technology for the EPD. It's just the moment she inputs the information. The same goes for the patients. They would have called the nurse for assistance. Now they would only have to make their request more specific. The sixth and last phase is implementation and benefits realization. We will start the pilot of a year with a functional design. This way we can monitor the project from up close. The problems the nurses and or patients stumble upon will be evaluated by our own team of experts. After a year, an evaluation will take place. Both nurses and patient will take part in this, so we can measure user satisfaction. Also, a measurement of predicted benefit will take place by having a group discussions with the user. After a successful reassessment of our product and maybe some changes, this project will be spread through other ENT departments. Our end goal is becoming an ambidextrous organization by taking it a step further. We want to implement our technology in other departments, with each project team specializing in different departments, because we believe that each hospital department asks for a different approach. According to O'Reilly and Tushman, this way of organizing our growth is a crucial ingredient for success. Lastly, the following clip gives a little bit of an idea of how this would work.